Okay. Hi. So welcome, everybody. I know this topic, pediatric to adult transition in healthcare, might not be relevant to what all of you do. So I'm going to try to, I do want to encourage everybody to think about it in the broad sense of transition, because transition applies to just about everybody, I bet. I bet a lot of you deal with vulnerable populations, and there's a lot of different kinds of transitions. So I think a lot of the principles that we're going to be talking about will apply to what you do as well. So I'm just curious, do we have any care coordinators here? Okay. And anyone in housing? Okay. And people that work with the elderly, aging populations? Okay. Did I not name anyone? Did you?
I'm a health coach.
Health coach. Well, that's good. Interesting. Maybe you can coach me. All right. So you know a little bit about VFN. I don't think I need to go over that again. You've heard it when we've come through. And if anybody has any questions, we do have some resources in the back there, both on VFN and on this topic that we're talking about today. So I'm going to ask you to do something for me. If everybody wouldn't mind standing up right where you are, that would be great. Going to keep you moving already. So everybody just cross your arms in front of you. Okay, now cross them the other way. How did that feel? Anything? That feel funny? Feel normal? Not normal? Anybody else? Shout something out.
Not normal.
Not normal? Okay. So it was a change that didn't feel natural. So I don't want anybody to do anything right now, but in a minute, I'm going to ask you to gather up all of your things and move to a different seat. Okay, I'm just kidding. I'm not really going to do that. But what went through your head when I said that? What were you thinking? Just throw anything out.
Really?
Really?
Yeah.
Yeah, it wasn't appealing, was it? It was like, I'm all settled here. This is my space. I'm comfortable. That was disruptive, wasn't it? So that's what you can sit down again. Thank you for bearing with me on that. I've done that a few times now, and I get a couple of the groups, I've gotten daggers shot through their eyes. And that's kind of, so that's what we're talking about today. We're talking about change. We're talking about something that's not comfortable. You know, you get used to things the way they are. You get to know someone. So that's what transition is. So that's just a simple way of saying what we're going to be talking about today. Whoops. Oh. Okay, here's our learning goals today. I don't need to go through those. I think you have them on the handout. We're going to go through each step as we're going through the presentation. And also, I didn't mention, we have, just in terms of scheduling, I'm scheduled until 9:45. We have a panel here like we've had at other presentations. And we actually scheduled the panel for 45 minutes today. In the previous sessions, we've gotten some feedback that people really liked that and they wanted more time for the panel. So we allotted more time. So I'm going to keep us on schedule here to the best of my ability. So why is transition important? Why do we need to talk about this? Well, like we were just saying, it's change. And change is difficult. Sometimes it's outright uncomfortable and you resist it. There's a lot of things to be considered. A lot of us here are talking about vulnerable populations, so it's a little more complicated. There's a lot of factors that you have to think about. There's a lot of planning that you have to do ahead of time. It's not something that can just happen overnight. It's also important because obviously we all want to do our best work. We want to help people be the most healthy they can, to stay happy, and to have the best outcomes, as we might use in the professional world. That would be the term. As vulnerable populations I talked about, and it's also a priority. You hear a lot about this in both on the federal level and the state level. You hear a lot about transitions. Sometimes it's transition from hospital back to home. If any of you work with people in that transition, that's a really difficult one. So in addition to the transition from pediatric to adult health care, there's a lot of different transitions, and it's a hot topic right now. So I just like this quote, and I noticed that when I turn my head, I'm really loud. I like this quote, and if I were to pick out a few key terms from here, medically and developmentally appropriate care, that's what we're aiming for, and to maximize lifelong functioning. So I just kind of thought that summarized it pretty well, so I threw that in. How many people here have heard of Gut Transition, the website? No? It's an incredibly valuable website. It was created out of a federal grant and tons of resources. There is some information on the back there, but it's guttransition.org. And I just highly recommend some of the tools that we put in your packet and some of the things we'll talk about today. You'll see that the presentation is kind of modeled after the way they structure things. And it's just got incredible amounts of resources for any kind of transition, I think. Even though it's really, again, it's that pediatric to adult focus, but the tools could be used in all kinds of ways. This thing is touchy. So gut transition is built around 6 core elements. We're going to go through each one of these, so I don't really need to go through them too much right now. In a little while, we're going to go through each one of them in a little more detail. First one, transition policy, we'll call that discovery. Second one, we'll call tracking, when you're really following things. Preparing. Planning, the actual transition, so that's the real action step. And then completion and the follow-through step. Again, we're going to go through those a little more, so I didn't mean to race through those. But so anybody here heard of a PDSA cycle? Okay. Have you used it before? Yeah? Yeah? Okay. So I'm not an expert in PDSA, but I do know some pediatric practices that have used this in their quality improvement process, and they've found it to be very valuable. And it's the kind of thing that you could use when you're going through a change, a big change, and it can help you evaluate that change. How effective is it? What changes do you need to make? So I'm bringing it up here because I think it could be a valuable tool in this process too. So PDSA is Plan, Do, Study, Act. It is a cycle. It's not a linear process. It keeps going and going. You're constantly reevaluating and fixing things to make them work better. I think there's some information in the back on the PDSA cycle. There's also, if you Googled PDSA cycles, you'd come up with a lot of information on it. So it looks at what are we trying to accomplish? How do we know that the change was actually an improvement? Are people better off for what we just went through? And then evaluating what just happened and how can we make improvements to that? Can we make it even better? So it is a cycle. So let's think about a simple example. How many people here have painted a room in their house before? Yeah, me too. So what do you do first? What's that? You prep the walls. Well, you look at the room and you say, no, this color is awful. Why did I ever paint this color? And so you think, I need to make a change in this room. And then you start thinking about, what do I need to do to prepare? When do I want to do this? And you go to the store and you look at all those hundreds of colors and you decide what color you want to use. So this is all the planning stage, okay? Then you get it all planned out. You've got your drop cloths down. You've got your paint purchased. You've picked out the day and the day has come and you paint the room. And then you take a step back and you say, how does this room look? You think, this color isn't exactly what I thought it was going to be. It looked different on that little piece of paper. How many people have had that happen? Yeah, me too.
That's why you get samples first.
Good idea. Yes, the samples. I actually tried that last time I painted a room, and it does work really good. I didn't even know about this. So you study it, and if you don't like it, you make changes. You edit it. So that's a really simple version, but just to give you an example of how the process works. Plan, do, study, act. So now we're back to those 6 principles from gut transition. They're on the top there, just so you know. That's directly from their website, discovering, tracking, preparing, planning, transferring, completing. The first one, it's a good idea to develop a policy or a statement, really just a practice. So it's not just about you and your work, but as an organization or as a group of people who do something for a population of people, what do you all agree that you're going to do? How are you going to handle it? So putting something in writing can really help that. And there's actually an example in your packet if you want to take a look at it. If you wanted to draft something, I just would highlight a few key terms in here, regardless of, again, whatever population you're working with. I think some of the things you want to look at when you're writing a statement. Who's going to be responsible for decision making? That could be, a youth transitioning to adult healthcare. It could also be an elderly person that is maybe needing more support in making decisions. So there's a lot of different scenarios that can play out. But responsibility for decision making, setting priorities, really important. So just putting it out there that you're going to help people pick some priorities. What are their goals? Where do they want to be? And for parents and caregivers to consider options for supported decision making. After you figure out what's their level of decision making ability, where are they at with that? And what do they need to be able to succeed and to make those decisions and to get what they need? And then the last paragraph just talks about assisting in it. So that's really the ACT cycle and doing the action cycle. We're going to help you get through this, and then we're going to follow up with you. So just kind of putting it all in writing just to formalize it and also to create consistency amongst your coworkers. So I talked about the consistency piece, but also it's recommended, Gut Transition recommends that you make this public. Be transparent about it. And maybe you want to post a copy of it in your waiting room. That's why I have a picture of a waiting room there. So establishing a tracking and monitoring system. So just have a way to identify whoever you're working with, whether it's youth that are nearing age 18, maybe they're 14, 15, and in school, that's when they start really looking at transition. They start writing the transition plan for transitioning from school to adult life. So just having it on your radar, who's going to be coming up to a transition? Having some way to track that. There is a flow sheet, and there's an example of that in your packet too, and that's from Gut Transition. And just something like that, and all of these things you can edit to your own use, but they can be handy. I'm kind of a list person. I don't know about you guys, but I like to have things broken down into steps, and it feels good to do that check mark on the list. So something like that can be really helpful for that. You guys are pretty quiet. So I have a tongue twister here. Who wants to be brave? Anyone? You guys are a really quiet group. Hey, thank you. Go ahead. Oh, you're really good. That was excellent. I can't even do it that well. Anybody else? Everybody awake? Is everybody awake? Okay. If anybody needs to stretch like that cat, feel free. Thank you for your bravery.
Oh, yeah.
So transition readiness. So there are, on the Gut Transition website, there are sample assessments. And so you can start there looking for tools for how to assess. Different people are going to be ready at different ages, so that's why you assess people. You have a process to go through. I'm sure all of you have done some sort of assessment before. And just to factor in transition as being one of the things that you assess people for. And of course, discussing individual needs and goals, that's going to be top priority in any of these. So again, we talked a little bit about this, the planning process. Who's going to make decisions for this person? If it's a pediatric to adult transition, or if it's an elderly transition of some sort, if it's hospital, maybe someone temporarily needs support making decisions. So really thinking about especially medical and financial decision making. Are there any directories that would be helpful to this person? Just kind of connecting people to resources too. And that's what VFN does a lot of that. So, and I'm sure all of you do that too. So, and plan of care. Does everybody know plan of care? Do you guys work with plan of care of some sort? Yeah. So they're called different things. Sometimes it's called a shared plan of care. Sometimes I think it's called a home health plan of care. So you might call it something slightly different, but it's kind of the same thing. So just making sure that that's always updated throughout this process of change. So transfer of care, just making sure that that appointment is set up for the new provider or the new person that's going to be coming into their life. Make a package for them. Who is this person? Give a little profile of the person so that when you hand them off, you're not just handing them off cold. You're kind of explaining a little bit about this person and who they are and what they want to achieve. What are their goals? And then just checking in. Is that new person ready? Did everything I sent you make sense? So ideally, it would be such a smooth thing. It would be just a handoff, a real smooth handoff. So I thought this was cute. So. And then the follow-up piece. The completion is achieved with that follow-up piece, and just making sure that you don't assume that everything is fine after it's been, just following up with the new provider and the person and saying, everything going good, just wanted to follow up and make sure that it was, so that's an important piece so that you don't just drop it. So I have a really brief video. I just thought that it articulated, again, this is from the Gut Transition website. It's a pediatrician talking about transitioning to adult healthcare, but I think she articulates a lot of the principles of transition pretty well. So.
Every pediatric patient will eventually need to transition to an adult provider. The age of transition varies between different facilities. Some pediatric facilities will allow you to stay in their hospital or in their office for an undetermined length of time, but it's really important to start to identify that you need to transition to an adult provider so that you are in a more age-appropriate setting. Every family can start to encourage their child to be more independent in their care. So they can make sure that the child will tell mom or dad when they're having symptoms, when they don't feel well. We can make sure that they register themselves when they go to visits. But then we want to make sure that families start to encourage them to be autonomous in other aspects in care. So for patients with more complex medical conditions who are on chronic medicines or on medicines that they take every day, families can start to encourage their child to be more autonomous in accessing those things. So that means having them call pharmacies and getting their own refills. And you can do it as young as the patient is developmentally appropriate.
Okay. Bye.
In order to get ready for the transition to adult-centered care, patients can start in their pediatric offices, practicing the skills that they need to know. I recommend that the patients sit next to the provider, making sure that mom isn't sitting next to the provider anymore and that the patient now assumes that role next to the provider so that they can be the person answering the questions. If the provider asks a question that they don't know, that they ask the provider to help them, give them the information, and then practice it at home. So that the next time they come for a visit, they will know the answer of what are their medications, what are their allergies, what is their surgical history. Also, the patients should be checking themselves into the appointment, so mom and dad don't need to give their name. The patients can go up directly and give their information saying, I'm here to see my provider. That way the provider knows that they're starting to be more autonomous in the care. Ideally, we want to encourage patients to start to be autonomous at the earliest age that is developmentally appropriate, and families and parents should be encouraging that. When patients come to a new appointment, physicians expect that they'll know their own medical information, that they know what their problem list is, they know what chronic conditions they have, they know what medications they take when they're sick, they know what medications they need to take every day. Understanding their baseline signs and symptoms is really important when they see a new provider. So if they normally have a high heart rate, they can express that, no, that's my baseline. That's not something that you need to work up, especially when they're seeing a new provider. They should know who their specialists are, and they should know who their physical therapist is. They know what pharmacy they use. They should be aware of their allergies to medicines and their previous medical histories, including their surgeries. It's really important that young adults start to carry information with them that will help them access healthcare should they need it. Families aren't always with our patients, and our young adults need to carry their own medical information. That includes an insurance card, a list of their medications and allergies, and a phone number of their providers. When you're transitioning from your pediatric provider to an adult provider, you have to be patient in establishing that relationship. Our patients have had 21 years or so to establish a really good working relationship with their current providers, and they often expect that relationship to be instant when they meet a new adult provider. So be patient with your new adult provider. You're going to be teaching them as much as they're going to be taking care of you. Often finding that adult provider is a challenge. Probably the best resource is other families who can give you their experience and let you know what providers have been advocates for their patients and their families. Even asking your friends, what adult providers do you use? If you are using multiple specialists, I often get recommendations from that pediatric specialist, what adult provider should I go to? Oftentimes, pediatric patients are seeing multiple specialists, and the specialists actually assume the role as the medical home for the patient. When they transition to the adult side, the patient themselves becomes the captain of that medical home along with their primary care provider on the adult side. I've noticed that there's been a difference between teenagers still being in a pediatric environment and still seeing young kids and toys, and they really want to be in a more age-appropriate environment, so oftentimes they are looking forward to getting into that older setting.
It is very hard for me to let her go and let her mature and be independent. And one of the things that I struggle with is that I always try to help her. And helping her all the time is making her kind of not be independent the way that it should be. So part of what we have done in the transition program is for me to let her go and for her to start doing it by herself. And it's been wonderful. She's doing good, and the support that we have with everybody has been wonderful.
I would say just try to do your best, try hard, never give up, don't matter what happens.
Mom said really well, but I have a child with special health needs, and he's 26 now, and I always kind of let him take the lead in his health care and how much involvement he wanted with professionals, and he never wanted a social worker or a paraeducator at school or a case manager. So we went through the Burlington school system all the way up to graduation without very much. He had a 504, and that one, it was very simple. And we never were involved with we never had anybody giving us advice or telling us what to do. And a lot of that was probably because I'm a social worker and I didn't need anybody to tell me what to do. It was sort of a thing. I just didn't want anybody else telling me what to do, and neither did he. And he went away to college, and we were still using his pediatrician. And he went to college in another state, and he got sick. And this was, even though he had a disability and he had a lot of issues around his disability, he didn't get sick very often. So this getting sick and having to go to the hospital was a new experience. So he called me from the ER, and I rushed over. And when I walked in and everybody was talking to him, I wanted to cry, because this was the first time that I wasn't the one making the decisions. I had raised him as a single mother, so I didn't share decision making with anybody. And they were asking him directly. They were doing exactly what they were supposed to do. They were right on target. They were looking at him. They weren't looking at me. They weren't asking me anything. But it was a really, really hard spot to be in. To have your kid sick to begin with, in another state where you don't have your support system, and then suddenly realize that there was some transition that probably should have happened that didn't, because we jumped right into now he's his own person. And so if I had it to do again, I would probably do it differently. And and would probably do a little more transition and have a little more planning.
Yep.
But that's just my mistake that I wanted to share, because it was hard.
It's
very
not
hard.
a mistake, you know, I mean, we all have, that was a great example, because it brought out a lot of things. It brought out that need, everybody's different, and, you know, there's an emotional piece, there's a human piece to this. It's not just the logistics of the transition, it's also the parent, or even if you're a child that has an elderly parent that you're helping do a transition, maybe that elderly parent is suffering some emotions because they don't want to be taken care of. They want to take care of theirs. So either, it's just something, it's all part of this, there's a much bigger process, a much bigger picture. And emotions are a big part of it. And having things on your radar is really it's a huge point out of this. And it sounds like, you know, things were going really well for you. Your son was, you know, not you and he didn't want or need that extra support, but maybe if it were on someone's radar, there would have been a couple of preliminary steps or even a conversation that would have helped that not be so abrupt for you.